Substance use disorders are widespread, affecting millions globally. These disorders don't just impact the individual struggling with addiction. They send shockwaves through families, especially children. The harm inflicted upon children exposed to parental substance use is often invisible, yet deeply damaging. These children face an elevated risk for a range of emotional, behavioral, and developmental problems. Today we will explore the profound impact of parental substance use on children's mental health. We'll delve into the emotional, cognitive, social, and developmental consequences they face. We'll also examine the barriers these families encounter when seeking help and highlight the urgent need for improved support systems. Finally, we'll offer evidence-based solutions to help families heal and thrive. A child's development is complex, relying on safe, stable, and nurturing environments. Parental substance use throws this delicate process into disarray and affects each developmental stage in different ways. Young children, especially, are highly attuned to their caregivers' emotional states. When a parent is struggling with addiction, their behavior becomes unpredictable, inconsistent, and often frightening for a child. This unpredictability makes it difficult for children to form secure attachments, essential for healthy emotional development. As children grow, they may take on adult responsibilities, becoming caregivers for their parents or younger siblings. This role reversal robs them of their childhood and places undue stress on their developing minds and bodies. The damage inflicted during these critical developmental years can have long-lasting implications. Children of parents with substance use disorders often live in homes marked by chaos and instability. They may experience neglect, abuse, or witness domestic violence. This constant state of uncertainty creates an environment where fear and anxiety become the norm. Children learn to suppress their own needs, becoming overly vigilant for signs of trouble. They may struggle to express their emotions healthily, leading to internalized problems like depression and anxiety and suicidality. This emotional turmoil leaves them feeling isolated and alone, and their well-being is impacted both in the present and the future. Growing up in the shadow of parental substance use significantly increases a child's risk of developing mental health problems. Anxiety disorders are common, fueled by the unpredictable home environment and their parents' inconsistent behavior. Depression often sets in, a consequence of chronic stress, emotional neglect, and a lack of safe and stable attachments. Post-traumatic stress disorder, or PTSD, is another significant concern. Exposure to domestic violence, witnessing overdoses, or experiencing neglect can be profoundly traumatizing. Adolescents may mirror the behavior they have had modeled to them by their parents with substance use disorder and engage in risk-taking behaviors, self-harm, and even substance use disorder. Without proper intervention and support, these invisible wounds can fester, leading to significant challenges in adulthood. Sadly, many families affected by parental substance use face significant barriers to accessing support services. Stigma and shame often prevent parents from seeking help, fearing judgment or the loss of their children. Limited access to affordable healthcare, including mental health and addiction treatment, further exacerbates the problem. The child welfare system, designed to protect children, often fails to provide adequate support. Part of the problem is a marked lack of coordination with other services, which lead to further delays in care. The welfare system tends to prioritize child safety by removing children from their homes, rather than preserving families through treatment and rehabilitation. These systemic failures perpetuate a cycle of trauma and disadvantage, leaving children vulnerable and their futures uncertain. Breaking down barriers and improving access to support. Addressing this crisis requires a multi-pronged approach that tackles both individual and systemic barriers. Reducing stigma surrounding addiction is crucial. We need to foster an environment where families feel safe seeking help without fear of judgment or punishment. Expanding access to affordable healthcare, including mental health and addiction treatment, is essential. This includes increasing funding for community-based services and ensuring culturally competent care that meets the unique needs of diverse communities. Strengthening the child welfare system is also vital. This involves providing caseworkers with smaller caseloads and the necessary training to effectively address the complex needs of families affected by substance use. Strategies for healing and resilience. Despite the challenges, there is hope. Evidence-based interventions can help families overcome substance use disorder and help children heal from the trauma of parental substance use and build resilience. Trauma-informed approaches such as trauma-focused cognitive behavioral therapy and parent-child interaction therapy can be highly effective in improving emotional resilience and coping skills. Family-based interventions like multidimensional family therapy can improve family communication, strengthen parent-child relationships, and address substance use within the family system. Early intervention and systemic change. Breaking the cycle of intergenerational trauma requires a commitment to early intervention and systemic change. Early identification and support for children impacted by parental substance use are crucial. Schools, healthcare providers, and community organizations can play a vital role in identifying at-risk children and connecting families with appropriate services. Policymakers should prioritize the development of community-based support systems that address both the children's well-being and the substance use in the family. Investing in prevention family-centered programs that address the root causes of addiction, such as poverty, trauma, and lack of opportunity, is essential. By creating a society that supports families and promotes mental well-being, we can break the cycle of addiction and prevent future generations from experiencing the same devastating consequences of parental substance use. A call to action: protecting our most vulnerable. The invisible scars of parental substance use can have a lifelong impact on children's mental health and well-being. These children are not only at risk of developing their own substance use disorder, but also struggle with forming healthy relationships, managing emotions, and succeeding academically. Unfortunately, due to systemic failures and limited access to support services, families are often unable to receive the help they need. It is our collective responsibility to break the silence surrounding this issue and advocate for the needs of these vulnerable children. Early intervention, trauma-informed care, and improved policies are critical. We must demand increased funding for research, prevention, treatment, and support services. By working together, we can give families a better chance at overcoming substance use disorder and create a world where every child has the opportunity to heal, thrive, and reach their full potential. Let us answer the call to action and ensure that no child suffers in silence. Their futures depend on it.